Good morning, everyone. My name is Shyamli Dhruv. I am from BJMC Civil Hospital, Ahmedabad. I am here to present my paper on to study the clinical profile of children with malaria admitted to Civil Hospital, Ahmedabad from January to December. Aims and objectives are to study the clinical profile of malaria in admitted patient between age group of 1 month to 12 years of age, to study various clinical presentation of malaria, to study various complications of malaria, and to evaluate immediate outcome of patient with malaria in terms of morbidity and mortality. Demographic distribution shows malaria is more common in lower socio-economic class due to poor sanitation and vector control. Species of malaria में P. vivax is most common. Clinical presentation among malarial patients are most is fever and chills and rigors being second presentation. Complications of malaria shows organomegaly like hepatomegaly and splenomegaly, anemia, thrombocytopenia, and severe malaria. Severe malaria is classified by WHO criteria. There are 10 criteria and any one among these is present.
Tell
it is classed as
tell
severe.
me your findings during the study rather than the theory. What percent? Don't describe the theory of malaria. You need to pinpoint what you did in the study. In the sense, what percentage was splenomegaly? What percentage was severe malaria?
Okay. Splenomegaly are shown in 22.2%.
22%.
22% showed splenomegaly.
Okay. Anemia?
Severe malaria transmitted in 5% of.
Okay. How did you diagnose malaria?
By peripheral smear.
Thick or thin?
Thick.
What's the other method to diagnose malaria? Any other method you know to diagnose malaria?
RDT.
RDT. What does RDT pick up? Antibody, antigen?
Antigen.
Antigen. Name two antigens of this malarial parasite that RDT picks up.
P45.
No. Any newer method? She said PCR for whooping cough. Is PCR for malaria available?
Yeah.
PCR for malaria is available. What would you prefer? If given a choice, civil mein everything is free. PCR is being done and આપણે જમાઈ કહેવાય ને સરકારના બધું free મળે આપણને. Yeah. So PCR is done and PS is done. Both are free. What picks up malarial parasite better?
PS.
By what percentage? PCR doesn't pick up malaria properly.
PS is better.
Per microliter of blood, how many parasites would be picked up by PCR and how many parasites would be picked up by PS? I'm taking 1 microliter of blood. Roughly, obviously no fixed figures, but what's the difference between the malarial parasite picked up by PCR versus MP picked up by PS?
PCR is better in that sense.
Why did you change your mind?
PCR is highly sensitive.
Malaria is one exception wherein if PCR picks up 1 MP, your PS would pick up 10. Right? So peripheral smear is still a better investigation. PCR is still not a good investigation for malarial parasite. Okay, good.
And on the